Hey there, I'm Dr. Ruth Roberts, your pet's ally. Hope that you are all having a great day and staying cool, because that's kind of the name of the game right now. I missed a question from Debbie about melatonin in the iPet's Ally broadcast we just did. And so, Debbie, I think you'll jump on here. I would start with a milligram of melatonin and see if that will help her sleep a little better and be more comfortable. So, sorry about that, but there you have it. And let me hop over to the Facebook page. And Kay's saying that her dog has decided he just doesn't like kidney beans anymore. You can use couscous. It is pasta, essentially, so wheat. So, remember that anything uncooked is going to basically double. So you would add something like, beans really is sort of half protein, half carbohydrate. So what I would suggest doing is adding something like an extra quarter pound of protein to a half a pound, and then add an extra probably 1 cup of rice or quinoa or what have you. So you can also try different beans. So you could try lentils or something of that nature that has a little different texture to it, and see if that is a little bit more acceptable. So you can try, so kidney beans are the ones that sort of are the most difficult to digest. So you could try, again, lentils, the white navy beans, field peas, things of that nature, black-eyed peas, see if that helps. And then if not, then add in a little extra protein and a little extra starch. So in great starches would be other things like peas, for instance. We think of them as veggies, but they really are more starches. And then also potatoes and sweet potatoes. So I hope that's helpful. And Kathy is saying, let's talk hotspots and Wi-Fi and all of that good stuff. Not Wi-Fi, rather, but safest flea protection options. So I am going to drop a link here from the website. There's several blogs in there that have some options on flea control, and I think that will help you get a good start. I think there's a recipe for essential oil sprays and things like that. Now, here's the deal, Kathy, is that if you live in an area where fleas are just rampant, some of these may just not be enough. And so so there's an essential oil recipe, treating the environment with nematodes, diatomaceous earth, flea busters, and then bug zone tags. Are a chemical-free way to use that. They use an electromagnetic frequency, so for pets that have had seizures, they may create a problem as far as diminishing the seizure threshold. And then, frankly, out of all of the stuff that's out there, Seresto collars are kind of the way that I would go. You can also use things like Wondercide. I mean, there's a whole ton of options out there, but the most important thing is to remember that fleas are only about 1 to 5%. The adult fleas, that is, that you see on your pet are 1 to 5% of the entire population. So make sure that you are treating the environment, meaning using something that will help kill the eggs and larvae outside as well as in the house, and that's in that. And Jeanette, garlic and brewer's yeast was kind of the old standby, and I've seen that work not very well in the Southeast. I think it just depends on where your load is. Like, if you're in a high heartworm endemic area, chances are good you're also going to see more fleas there as well. So high humidity, that's when they tend to reproduce more frequently. When it gets so hot, they actually stop and kind of come back in the fall in the Southeast anyway. And Pamela's asking, what do I change in the original Crockpet diet for kidney disease? And Pamela, I'm going to tell you that depends on the numbers that are there. So a lot of people will, a lot of veterinarians will say, oh, your dog has kidney disease, and what it has is a creatinine elevation 0.1 higher. Now, I'm going to tell you that that is, of concern to watch, but because you are feeding a little bit higher protein diet with Crockpet, you're going to see those numbers potentially come up a bit. So first of all, make sure there's no UTI, and yes, this picture of the kidney health course is this is kind of the intro course, and then there's also a much more deep dive program. So, and again, if you have medical questions like this coming up, I'm going to tell you the basics you can do with the Crockpet diet, but for specific questions about your pet, that's where joining iPets Ally really helps quite a bit. And then Kathy, I think or Pamela, excuse me, had a question too. Let me pop back over here a second about, let's see, where is this sheet? Here we are. So if your dog truly is in kidney failure, then that's when I would think about dropping the protein level. But until then, no, I wouldn't. And and then your other question is about the blood work coming back with cholesterol, magnesium, and creatinine above normal. And so I would look at how big are the elevations, how long has it been since you've had lab work done, and then what else to do. So cholesterol typically gets elevated when either their thyroid function is beginning to trend down. Magnesium is unusual to be elevated, but it may be you just need to kind of alter the pH. That's your third question. The pH is high, and that does happen with Crockpet because of the amount of vegetables that are present. So normal pH is 7 to 7.5. Too high makes them more susceptible to stones and crystals and UTI, but so does too low, and that is anything south of 7. So what you can do, if it truly is, the urine pH truly is outside of that 7 to 7.5 range, is to add a little bit of vitamin C. And if you've got Goldies, then I would say probably something on the order of about 250 milligrams to start. Get a urine pH or pH test strips, and just check everybody's pee first thing in the morning until you kind of get it honed in. So I hope that's helpful. But Kathy, or Pamela rather, it's hard to know kind of which what needs to be done specifically without looking at the labs, and that's kind of beyond the scope of this group. So check out iPets Ally if you have not. And then Susie, I know that's okay, and I'm coming over your questions. So what I would say is if the hematoma is shrinking, that's great, but because this was caused by a cat fight, this does have the potential to get infected. So what I would do is clean it off, drain it as best you can, and use some sort of a Epsom salt soak to help pull out any infection. And you can also apply like a topical antibiotic cream, like a Neosporin. They've taken out the bacitracin part because that's what creates the issues as far as skin reactions to it. So try that out. I think this is all we've got today. I've got Kay's question already. Let me double check and make sure we've got you covered. Yeah, and I'm not sure how this one. Oh, I see you. All right, good. So I think that's got all the questions covered. If you want to check out iPets Ally, check out this landing page So what it does is get you access to basically all the digital courses I've got. We do another, yeah. So Susie, we do another weekly broadcast, usually after this one, to answer people's specific health questions, and then we do a monthly teaching session as well. So check that out. It is you can do a $1 trial, and then otherwise it's $30 a month. But I think for folks that have joined iPets Ally, it has been a superior value. It also gets you a 5% discount across the board on all of our products with a special discount code as well. And then Susie, you can use that generic. That's fine. You do want to make sure it does not have bacitracin, because that is the component that was creating some skin. Sorry, that's a product name. I'm sorry, I had a cold last week, y'all, so my brain is a little slow. So it was, yeah, it is bacitracin actually. Bacneopoly is what we used to have and all of that, but I think Neosporin is just polymyxin and a couple of other topical antibiotics, so you do want to avoid the bacitracin. That is what I have for you this week. You all take good care. We will see you next week. Until then, remember your pet's best health starts in the bowl.